April is Autism Awareness Month, a time dedicated to raising greater awareness about autism spectrum disorder, promoting understanding and acceptance, and celebrating the unique strengths and abilities of children on the spectrum. Communities worldwide come together to celebrate Autism Awareness Month, promoting understanding and acceptance of autism spectrum disorder. This observance has evolved significantly since its inception, marking several important milestones along the way. This month provides an invaluable opportunity to learn about ASD, explore effective interventions like applied behavior analysis, ABA, therapy, and discuss how we can all contribute to creating more supportive environment for the autism community. World Autism Acceptance Month is an opportunity for everyone to come together and raise awareness, foster acceptance, and create society where autistic people are supported, understood, and empowered. Interesting. And joining me live to put a better perspective on autism and how to support individuals on the spectrum is the Programs and Consultant Associate with RBM Autism Foundation and Center in Woye David. Good morning.
Good morning. Thank you, sir.
Thank you so much for coming on the show.
Thank you so much.
People around with autism because of your foundation. You know. Tell us your experience and why you decided to have this foundation first.
Okay. RBM Autism Foundation is an organization that is focused on increasing and improving and raising awareness on autism in Nigeria, promoting it acceptance, and actually ensuring individuals on the spectrum are actually being carried along, included in our Nigerian society. So with this drive, we've been able to raise positive awareness and create impactful campaigns in states across Nigeria like Ekiti, Anambra, Abia, and the FCT. But throughout the course of our drive to actually improve the comprehension of autism among the general public, we discovered that individuals on the spectrum were not really getting the care they deserve. They're not really getting this intervention that is tailored to their needs. And that is what led to the establishment of our 24/7 holistic care home, where we provide round-the-clock services to actually help these individuals on the spectrum to actually get the necessary interventions, support and accommodation that is tailored to their need, to actually achieve the necessary behavioral modifications that will help them do better and live better.
Okay, so, how can we support, individuals with autism, most especially, and their parents and caregivers? How can we support them?
Okay, definitely. One thing about individuals on the spectrum, autism is actually a neurodevelopmental disorder, and this disorder is it comes with a lot of cognitive and behavioral challenges that actually affect individuals on the spectrum. So the basic support that individuals on this spectrum can get is necessary therapy that is tailored to their individual needs, which is actually cost-effective for so many families with children on the spectrum. Also, the government itself needs to actually create policies that will actually promote, the inclusion of these persons in our society and actually give them the needed access to education, healthcare services they need to actually do better.
Okay, so I think there's one question I'd like to ask.
Okay.
What exactly causes autism?
Well, so many persons have been raising eyebrow on the cause of autism, but scientifically there is no proper or definitive cause for autism, and it's also the same for other neurodevelopmental challenges, because neurodevelopment is the process whereby the nervous system forms the brain, the spinal cord, and the nerves. Now, during this process, when this process is disrupted or affected, that is what leads to neurodevelopmental disorder. And this neurodevelopmental disorder is actually characterized by these cognitive and behavioral challenges. So scientifically, we can't say this is the cause for autism, but definitely we have some factors that actually increase, we call it risk factors to autism. Maybe like the exposure to harmful chemicals during pregnancy, maternal nutrition, genetics, and as well as we can also look at issues around environmental factors. But for sure, there is no cause for autism. Autism is something that they are still researching on to know if they can actually get to say this is a particular cause. It's not like other conditions like malaria where we can say, okay, when you get in contact with mosquito, then this happens. But for autism, we can't say this is the cause. It's just a neurodevelopmental challenge because the development of the brain is actually a complex process. It is a complex process. So the etiology of this neurodevelopmental issue is not well defined because this process is complex, from the formation of the neural plate to the formation of the neural tube that divides to form the brain and the spinal cord and other nerves. We can say this is what causes autism, but we have risk factors to this that are already highlighted, and these are the things we look out for. And when you say it's a spectrum, that means individuals on this spectrum, they actually show different symptoms and intensity in their behavior. So you can't, when you see one patient on autism, you've not seen all, because it's a spectrum. You can see somebody exhibiting this particular aspect of the spectrum.
Let's explore that spectrum and how it works.
Okay, how the spectrum works is, spectrum, like, it's just an English term that shows you, okay, these things happen on different levels. So the intensity and the symptoms in different individuals widely varies. Now you can see someone that is vocal, some are non-verbal, some it's just challenging. Some are non-verbal, some are verbal, some are actually they can actually tell you their needs, but some can't. And that is why when you see the children on the spectrum, you can't actually say this is the actual sign and symptoms for this spectrum because it is wide and diverse.
Interesting. You know, you just remind me of when I had a guest on the show. Yeah. I asked the guest, what's the cause of cancer? They can't. They're still making findings. Making findings.
Research is ongoing because definitely some health conditions are things that we can't say this is the cause for sure. But definitely with time and advancement in research, maybe we'll get to say, okay, this is the cause of autism. But for now, we don't have a cause for autism.
Okay, so children who are autistic usually have real talents. You know, their abilities range from music, painting, and so how can parents, when they manifest this help, can they help them develop it easily? Because there's also a challenge of, you know, when you develop these things, you have that fear. How do I help this person develop this talent?
That is why centers like the ROBF Autism Center was established, and most times we help to spot the strengths of these children. Now we have a parent last week. She was telling us how she discovered that her son have this strength in music. He's actually an autistic boy. So definitely our center actually provides this therapy that helps us to identify the needs of these children. Also educate parents on how they can go about, you know, tracking these children day-to-day activity to get to understand what they actually have interest in, because it is characterized by repetitive and restricted behavior, interests, and activities. So observational therapy will actually help you to understand, okay, what does this child really need? What does he want? What does he do better? And then you can actually help him find strength in that area. And that is how it works. So it's mainly by observation that can help you actually find what this child really wants and help him develop in that area.
Okay, so what happens with parents who don't care, who don't observe?
And that is where the issue of we bridging the knowledge gap comes in. Okay. Because it is one thing for people to be aware, it's another thing for them to have knowledge of what it is, and it's another thing for them to accept that, okay, this is what it is. Now, a parent came to the center within this week. She was saying she has beaten the hell out of a child because she never knew anything like autism exists. So in Nigeria, we believe more in discipline, but the child was on the spectrum, and she kept beating to actually modify this child behavior. But beating will not solve the problem. It is the interventions that will actually modify the behavior. So most times for so many parents, it is this knowledge issue that has been actually causing the problem, because when they have full knowledge of what this thing really is and how this thing can manifest in their developmental milestone, because you have to observe, okay, at 1 month of age, there's some certain milestone your child should have attained. At 2 months, at 3 months, even down to adulthood. So when this child is not actually attaining this milestone accordingly, that calls for concern. And you need to take this child for expert counseling to actually get definitive clinical diagnosis to say, okay, this is what is suspected and this is what is to be done. But most times the knowledge is actually very low in this part of the world. And that is why we continue promoting awareness and actually trying to raise knowledge about autism in Nigeria.
Tell us how challenging it is to raise an autistic child.
It can be very challenging. It can be very challenging. Sometimes so many parents get tired of the whole thing because a lot of misconception is actually wrapped around this condition. A lot of problems around it. Now, it can be challenging to a point. Financial challenges can actually come up. That is one aspect of it. It can be financially challenging. The financial burden of raising a child that is autistic is very, very, very high. Apart from that, their behaviors can be so aggressive at times, depending on how they are exhibiting their own spectrum. So most times, for so many parents with children on the spectrum who have understanding of what this thing is, to them, they've embraced their challenges and they are raising these children the way they should be raised. But to some that have not really understood what this issue is, they still have this difficulty raising their child. But definitely, it can be very challenging because it comes with a lot of, I don't want to call it drama right now, but it comes with a lot of divergent behavior that can be heartbreaking most times. But definitely with proper understanding and knowledge of what the spectrum is, parents have to accept that, okay, this is what it is. I was talking to a woman one time. She said she prepared for a room and what she got was Amsterdam. She was preparing for a delivery, but when she delivered, she now discovered her child was autistic. She had to accept what she had, and she had to do what is necessary to help this child become better in our society. So acceptance from parents is very, 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 very important.
Let's speak about the financial aspect of this,
okay,
which is very important. How hard it is for to have a child with autism in terms of meds, in terms of special schools and all, how hard it is. Knowing that you also run a foundation, how hard it is.
In terms of finance, it can be very challenging, like I've said earlier, and that is where policies from the government need to come in. Donors need to come in to actually help identify most of these children on the spectrum, because all hands are not equal. We can have children who are on the spectrum and maybe their parents are the average Nigerians that can't get to even afford the necessary intervention, therapy for these children. Therapy can be very expensive. Definitely schools for special needs are also very expensive. Their nutritional needs are also very expensive. So the government have to actually formulate policies that will actually support this person financially and build them to become better. Because in as much as we have other health conditions that have been covered by the National Health Insurance Scheme, I think the National Health Insurance Scheme should cover for children that are actually autistic too. That will actually help to reduce the financial burden on families and individuals on the spectrum, because it is actually very financially demanding to actually manage the condition.
Because I'm beginning to look at how the one you just raised now, to help give succor to children who have, parents who have this autism. So there should be like a succor from the federal government that can help them.
Donor agencies.
So how can this be tailored to the federal government in looking at, okay, why you're looking at this other aspect? Because I know that they now give for cesarean, so how can this be tailored to the federal government? What are the policies that need to be put in place for this to manifest?
No, I think there needs to be direct reduction in out-of-pocket payments for children on the spectrum. These children are actually special needs children, let's put it that way. So they should be, their needs and wants should be prioritized, highly prioritized. So when we can reduce this direct out-of-pocket healthcare payment, it can actually help to actually curtail some financial difficulties that parents experience by having children on the spectrum. So that is like what the Minister of Health did, where he declared that cesarean section in most of our Nigerian government hospitals are free. Things like this can actually happen. Declaration like this too can help. Okay, fine. The diagnosis of this condition is free. And for foundations like our foundation, the ROB Autism Foundation, that provides the necessary interventions to manage this condition, okay, this is what is to be done. We can actually help to subsidize the cost of these therapies to to actually help these children become better. So this is the best thing the government can do. Reduce direct out-of-pocket payments on healthcare and maybe incorporating it into the National Health Insurance Scheme for those that are on the scheme. That will actually help parents having these children on the spectrum to actually be able to cope with this financial implication of having these kids.
If you look at the Disability Act, it's supposed to include, the autism children. How do we begin to have, an inclusion of these people inside this? Because it's supposed to address all of these things. Yeah. How do we begin to have that, that kind of thing inside the Disability Act? Because if you have a Disability Act and the autism is not part of it, then that's a problem. How do we begin?
I think it starts from increasing surveillance on autism. Now, the problem is we have epidemiological data that is showing, okay, this is the prevalence of autism we have in Nigeria. Okay. But this data is actually insufficient. It's not really reflecting the reality of what is on ground. Okay. And this is a general problem, not only in the health sector, but even in other sectors. Issue of data collection, collation, to actually show what is on ground. So definitely, the only way we can actually increase the understanding of our policymakers in this area is to actually improve surveillance for this condition. Now, when we know this thing is on the rise, now they will tell you 1 in every 150 children have autism, are autistic. Now, it can be more because this is just an epidemiological data that is not really showing what the reality is. So maybe when we have something that can actually call their attention to it by improving surveillance of this condition, active surveillance, then they will actually consider implementing policies that actually cover for children on the spectrum also.
I heard something and I just wanted you to maybe just clear me. I'm a novice in the medical profession anyways. Is it true that everybody's autistic?
Everybody cannot be autistic because definitely our development, in as much as what is considered normal during our developmental milestone, there can be variations to it. Everyone can be autistic. The only thing is we have mild, severe form of autism, but everyone is not autistic. And definitely, diagnosis will actually show that. And one thing about autism is it actually comes with other morbidities, like the attention deficit hyperactivity disorder. It comes with it because they are categorized, according to the International Classification of Disease, edition 11, it shows they are all categorized under neurodevelopmental disorders. So most times, everyone can be autistic. It's not possible for everyone to be, just like we say everyone has malaria. Everyone cannot have malaria at the same time. And that is why even the World Health Organization at some point had to scrub out the this issue of without test because it shows so many true negative. So definitely everyone is not autistic, but there are persons who are autistic. And these are due to conditions surrounding maybe the period of their birth, before birth, or during pregnancy. What was their parents or maybe the mother, maternal nutrition? What were they consuming? Were they complying with their routine drugs? Folic acid to actually reduce this issue of neural tube defect. So everyone cannot be autistic, and it's not possible for everyone to be autistic. But the few individuals who are autistic, we need to do something to actually help them live better and actually address their challenges properly.
Let's talk about their talent.
Yeah.
And how important it is that their talent is even being showcased, for the world to see. And I think that that's a major part of this conversation. Why? Because when you look at the ratio of, if you put for example, I want to say normal children, but let's just...
That's neurotypical. Just use the word neurotypical children.
Neurotypical children. Yeah. Then you have the autism children.
That is neurodivergent children.
Exactly. So there's always that possibility that the ones with the autism sometimes, or majority of the time, are more talented than, sometimes are more talented. How do we begin to harness that part? I think in this part of the world, we've not really been able to do that. How do we begin to... I think there was one of recent, who painted the largest painting in the world. Exactly, who painted the largest painting in the world. How do we begin to harness these talents for the benefit of mankind?
The only way we can harness these talents for the benefit of mankind is we actually improving access to the necessary interventions these children deserve. Because it is in that process that this talent in them can really be discovered and harnessed for them to actually come to their full potential and full realization of what they can do. So most times, if we just allow these children to be where they are, not actually getting this intervention, because in these interventions, it involves clear observation over time. And when you keep observing what these children can do over time, that is really where you can harness that potential in the child. So it is not something that is home-based. It's something that needs expert counseling and opinion on to actually identify this potential of this child. Because some of these children have beautiful potentials. And if well harnessed, it will be for the benefit of mankind, like you said. But it starts from giving them this opportunity to actually have the necessary interventions they deserve. That will actually help to identify these potentials in them, then harness it for the betterment of mankind.
Thank you so much, David. Thank you so much for coming on the show.
Thank you.
It's really been an interesting discussion.